Hi all, welcome back to my YouTube channel. So today I'm doing a CPT topic, evaluation and management. We all know evaluation and management. It is a very important topic as well as it is difficult for most of them. Okay, so today I will discuss critical care portion of evaluation and management topic. So what is critical care? Critical care, it is the care that is given by the physician or other qualified healthcare professional to a critically ill or critically injured patient. Okay, so when can a patient be considered as critically ill or critically injured? It is that if the condition is a life threatening condition, that means if the treatment is not done means the patient's life is in danger, that is the death, even the death can happen. Or if the treatment is not given, it can lead to organ failure or organ system failure, means that is a critically ill or critically injured patient. Okay, so sometimes in the question it might be directly given. Most usually it will directly give us it is a critical care is performed. In that case, you can take critical care codes. Otherwise, the above mentioned criteria should be satisfied. Okay, the next point: critical care is not always given in critical care areas. This is an important point, which means the critical care it can be given from anywhere. It can be given from ICU, it can be given from NICU, it can be given from a burn unit, it can be given from emergency room or ambulatory surgical center, anywhere. If the procedure done is critical care means you can give the code for critical care. Okay, it need not be always ICU. Okay, next, the critical care codes are divided on the basis of inpatient or outpatient critical care. Okay, what is outpatient critical care? Outpatient critical care means outpatient means the patient is not admitted. If the patient is not admitted means it is considered as outpatient. Okay, so that the critical care given for outpatient is outpatient critical care, and the critical care performed for an admitted patient is inpatient critical care. Okay, so the outpatient critical care we have only two codes, 99291 and 99292, and they are age independent, which means the patient may have any age, even if the patient is a pediatric or neonate, or the patient is an adult or old age, whatever is the age. If the critical care is given from an outpatient area, that is an emergency room, or somewhere, means you can give these two codes, 99291 and 99292. Okay, then the inpatient critical care is age dependent. That is, we have, if it is an admitted case means, then you have to look at the age. Okay, that is up to 28 days. From birth up to 28 days, the code is 99468 and 99469. Then from 29 days up to 24 months, that is 2 years old, means 99471 and 99472. Then pediatric inpatient critical care, that is 2 years old to 5 years old, is 99475 to 99476. Then above 5 years, specifically given as above 71 months, is 99291 and 99292. Here you have to note one point, that is for above 5 years old, the inpatient critical care code and outpatient critical care code is same, 99291 and 99292. That means if the age is above 5 years old means it is not outpatient or inpatient is not a matter. Okay, even if it is outpatient or it is inpatient, the code is same. Okay, below 5 years we have outpatient separate code, inpatient separate code. Okay, next is the total duration of critical care code. That is how we have to select this 99291 and 99292 based on the time. So here I have given a table. The same table you have in the CPT book above the code 99291. In this table you can see in the first section time is given. The time is given in minutes as well as in hours. Then the second section, appropriate codes are given. So the first one is less than 30 minutes. That is, if the total duration of critical care given is below 30 minutes means you need not give this 99291 to 92 codes. Okay, you have to quote the appropriate E&M code only. Then if the time is 30 to 74 minutes, or if it is in hour, 30 minutes to 1 hour 14 minutes means 99291 into 1. Okay, like that you have to look what is the total duration of the critical care code. Then if it is minutes or in hours, you can check it here and take the appropriate code. Okay, for example, if the total duration is 115 minutes means the code will be 99291 into 1, 99292 into 2, like that. Okay, then I will give you some additional point, that is the critical care, it need not be continuous. That is the physician can give the critical care in a day more than one time. Okay, but the code, how to take the code, you have to add all that critical care duration. Okay, which means the physician might have given 30 minutes of critical care at 12 o'clock, then after that at 1 o'clock the physician may again given 30 minutes of critical care. Means you can add both these 30 plus 30 and you can take the total as 60 minutes of critical care. Okay, but one day 199291 code should be there. Okay, then the next point is, for giving, whenever giving a critical care code, the physician need not always be there in the immediate bedside. The physician can be in the immediate bedside, or the physician can be in the same floor or unit, but the physician should have performed the activity or service that is directly related to the treatment of the patient. Okay, that is, even if the physician is reviewing the diagnostic test or imaging studies of the same patient, or if the physician is discussing about the treatment option of the same patient with the nurse or another physician or with the family members, that all are related to the treatment of the same patient. No, so that all can be calculated under the critical care duration. Okay, but in the same 1 hour, if the physician is attending another call of another administrative meetings or something else which is not directly related to this patient, means that time cannot be considered as the critical care of this patient. Okay, that is some additional points. Next, I have given the list of some services. If these services are performed at the time of the critical care, means we need not code additionally for these service. Okay, that is already this 99291 and 99292 include these service. For example, if a patient of a 70 years old is given critical care, and at the time of critical care his chest x-rays are taken, means this chest x-ray code is already included in the critical care, so this chest x-ray codes need not be given additionally. Okay, whatever in this list, whatever be the procedures, gastric intubation, ventilatory management, temporary transcutaneous pacing, whatever be done at the time of critical care, it need not be coded additionally. Okay, if any procedure other than this list is performance, you have to code it additionally. Okay, this is for 99291 and 99292. Okay, similarly you have one list in your textbook for inpatient, pediatric and neonatal critical care also, that I have not given here, but you can see in the textbook that session those services which are included in the critical care service of inpatient, pediatric and neonatal. So hope critical care is clear for you. Thank you.